You've been told you need pelvic floor therapy and you're wondering if that's painful. If that's your story, stay tuned. Hey, this is Dr. Shakib from Core Pelvic Floor Therapy right here in Irvine, Orange County. You either are just going through YouTube, checking out pelvic floor and anything related to it, or you actually were told you have pelvic floor issue, you need to seek treatment for it, and you're wondering if that's painful. The answer is yes and no. It depends. My least favorite type of answer is when it says depends, because I was hoping for yes or no. It depends because there are different presentations of pelvic floor dysfunction. Pelvic floor dysfunction is the name of a book with many chapters. Which chapter you belong to and what is the problem. A lot of times we go in to assess the problem and what we see is, wow, this is a lot more intense, or it's not as bad as I thought it would be. What I advise you to do is don't start working on the floor by itself as if it's gonna be worked on and stay nice and clean and strong when the pelvis itself is unstable. You cannot have weak pelvic floor. Weak does not mean relaxed. You can have spastic pelvic floor and that becomes weak from over spasticity. You can't have weak pelvic floor and have a stable pelvis. So the question is, should you address the pelvic floor or the pelvis or both? It has to be both. So in our office, we're more into stabilizing the pelvis and preparing it for internal work. So if the internal work has to do with movement and posture and functionality and the surrounding joints like the hips and back, we actually address that as well. If it has to do with prolapse or things like that, we refer out because we don't see patients like that, and it's best for the patients to go to someone who does that more often. So is it painful? It all depends. If it has to do with internal work, sometimes it's painful, sometimes it's not. If it has to do with the external work, most often it is not. Unless we get to a restricted joint like the hip joints with lack of mobility or SI joint, sacroiliac joint here. We address the whole torso to stabilize the pelvis. Therefore, in the process of doing that, you may have not so much pain, but you'll realize how weak everything is. So the answer is it depends. The short answer is depends, and the long answer is the video I just did. If you like the video and you want to get more information on pelvic floor treatment, pelvic floor dysfunction treatment, please make sure you subscribe to my YouTube channel. Check out my blogs. All that information is in the description box right below this video. And if you need to make an appointment to come in to see where you stand, again, check out the description box and we'll see you at the office. Until next time, take care.